Hi, my name is Bailey Harris, and I'm an occupational therapy assistant student at Arkansas Tech University. And today we're going to be talking about some exercises that you can do for a patient that's had a burn injury to the wrist. Okay, so there's three main exercises you can do for someone that has had a burn injury to the wrist. The first two we're going to talk about are very similar. So the first thing that we're going to talk about is wrist extension and wrist flexion. So for wrist extension, you're going to want to go ahead and extend your arm all the way out. And for wrist extension, we are going to have our palm up, okay? And what we're going to do is we're going to stretch our arm. I don't know if you guys can see, but we're going to extend that wrist out as far as you can, okay? Just like this. And when you do this, you want to have support on both the palm and on the fingers. You want to be about halfway in between, okay? All right, and to make this a little bit harder for your patient, they can make a fist with their fingers, and if you push right here, they get a little bit better stretch, all right? So it's the same concept for wrist flexion. You're gonna want your arm extended again, but you're gonna have your palm down. Again, we're gonna have support over the carpals, all right, and over the fingers. And again, we would be extended, but I'm kind of showing y'all right here. All right, you just push, and I can already feel that stretch. So for a patient that's in an acute phase, they're probably not gonna be able to stretch for a full 90 degrees, okay? All right, and again, to make it harder, you can make a fist, push down, all right? So the last exercise we're gonna talk about is radial and ulnar deviation, okay? So you would have your hand down, the affected hand, okay? And we would do, you would use your other hand for support. You're just gonna rotate that wrist towards your thumb side. This is gonna be your radial side, okay? All right, you can go as far as you can. All right, you're gonna come back. Now we're gonna do ulnar deviation, which is your pinky side, all right? And you have this hand for support, okay? And I would hold these each for about 30 seconds, okay? And I would say you could do this for about 3 or 4 minutes. So you can come here, 30 seconds, flex 30 seconds, do radial and ulnar deviation, okay? And you can do that for about, I would say between 2 to 5 minutes, as much as you can take. And also you can do it 2 to 3 times a day as well. So what this is doing is it's going to increase that range of motion. Okay, so like I said, for someone in an acute phase, they may not be able to extend or flex all the way at all. Okay, they may be able to just go about 30 degrees. So this is going to help increase that range of motion. It's also going to help keep their functional strength, increase that functional strength as they go, and it's also helpful to decrease with edema and swelling. So that's what I have for you guys today. Again, we're talking about wrist flexion, wrist extension, ulnar, and radial deviation for burn injury on the wrist. And I hope you guys have a great day. Thanks.